Alrighty. Good morning, everybody, and thanks for joining our June Capital Chat. If you don't know me, my name is Brady Werger. I am the chair for the Iowa Developmental Disabilities Council, and I want to thank and welcome all of you for attending this today. We will be talking about federal policy today, and so we'll have a lot of good talks on that. And then if anybody has any questions, feel free to speak up and join in, and we will get those questions answered for you. Um, I want to pass it over to Carlin Crow to introduce our first speaker today, Garrett. Carlin, you have the floor.
Thanks, Brady. Thanks for doing that welcome, and thanks for joining today, everyone. As Brady said, and by the way, my name's Carlin Crow, and I'm the Public Policy Manager with the Iowa DD Council. And as Brady said, today we're focusing our capital chat on federal policy, federal advocacy, and federal activities that are going on, um, which all relate back home to all of us here in Iowa. And none more so in a more meaningful way than what has recently happened with Garrett Fry. And so I have the honor today to introduce Garrett, who's going to talk about some very exciting things that have happened to him recently. And if you want to pull up the slide, Emily, we have a picture of Garrett and his recent trip to the White House. Last week, actually on June 20th, he was he was invited to be part of the ceremony and on a panel of speakers that celebrated the Olmstead decision. It was the 25th anniversary of the landmark Olmstead decision that determines how we provide services to those who want to stay in there and live and work and play in their homes and their community. And Garrett was invited to be part of that. And at the same time he was there, an announcement was made. It came from the U.S. Department of Health and Human Services. And as stated here on the slide, that a decision had been made in his case where he made a complaint to the Office of Civil Rights under HHS, and it was deemed an appropriate complaint that now the state of Iowa needs to work with their office to provide Garrett with the services that he needs to stay in his home. That he was his complaints to the state and to the Office of Civil Rights was that what the services that he was receiving were not enough for him to be able to stay at home full time in his home. So as you can see here, the um, as it mentions at the bottom, the Office of Civil Rights Action will ensure that people with disabilities receive services in the most integrated setting appropriate to their needs. So I just see that he put the YouTube video from the ceremony in the chat for you all to check out later. I was able to watch it online. Garrett did an awesome job. And we're just so proud that he was able to be part of the ceremony, that he had his decision um, in his favor, and that he's such a dedicated advocate here in Iowa. Garrett's from Cedar Rapids. For those of you who don't know him, he also won our Lifetime Advocacy Award last year. So how appropriate that right after that, he makes another major milestone in his life. So we're really proud of you, Garrett, and we're so glad to have you here today to tell us more about your decision and all the other work that you, not all the other, because it would take too long, but all the other amazing things that you have been doing in your advocacy work. Welcome, Garrett.
Thank you, Carlin, and thank you, Brooke. Thank you. Brady, for everything you do. Uh, it truly takes a team. It truly takes an effort for each and every one of us to do what we do every day. Uh, this is truly uh, not about Garrett. It's not about me. It is one step that the state has agreed upon and HHS has agreed upon. But to be honest with you, I still currently do not have 24/7 care, actually. Um, and my mom does a lot. She's always been there for me. I give a lot of credit to my mom, especially. She's the most important person in my life. Um, but it's all of you. You guys give me strength. You give me encouragement to keep on um, fighting and doing what is right and ultimately what is just. So, um, I guess I'll start out saying, in addition, uh, this was for 24/7 care. I am a ventilator dependent man with brown hair, brown eyes, and I'm wearing a blue shirt that actually it is from the US Senate gift shop. When I was out in DC, I was lucky enough. I worked with many great people and I met many great other uh, disability advocates. I heard many great stories. Um, and I made a few contacts. So this is great. I'll tell you, um, it also included uh, for myself to receive respite services before uh, for about the last 12 years. My mom and I have tried to do the best we can every day. I've had a few caregivers. We did have a couple part-time nursing agencies, but they kind of fell through when the managed care organizations started coming in. Um, for me, it was an honor to go out to be able to share part of my story with everyone, but with without the support and help of all of you, I really don't know where I would be. I know myself. I did a little homework. I had to do a lot of research. Uh, it took, I wrote my first uh, letter or I filed a complaint with the Department of Justice in the Office of Civil Rights in 2019. And then in 2021, we wrote another one. My mom and I um, just wrote a letter stating what we are going through, what we live, uh, our lived experience, shared our story, but we found another case that was out of Maine, which is very similar to myself. And uh, we found out last summer when we first started speaking with them, both privately and with um, people within the state, and also um, my managed care uh, organization. Um, we worked through some things. We've been speaking. I will tell you currently that the state is still investigating, or the Office of Civil Rights. Excuse me, I apologize. The Office of Civil Rights and the Department of Justice is still investigating the state for 6 more months, but it could be up to a year because it's not. I know personally, there's only about a handful, maybe 10 individuals, people that are like Garrett in Iowa. Uh, I really truly feel like many of you need to speak with your case managers first. If you do not get anywhere with your case managers, we all have the right to ask for another case manager. In addition, I would say if you're not getting anywhere, please talk to your legislators. Let them know. And if you're not getting any kind of response, try to speak with someone at HHS. If you really need more help, feel free to contact me. I'll give you that information later. And if you can do your own research and um, simply Google DOJ versus the state of Michigan, Ohio, Washington. There's many other states where there's cases that will follow suit. So many of us, I can't keep up right now. I still have not posted things on social media. I'm still going through my own emails, uh, different things. But if you find a case that's similar to you, try to look around off the civil rights. versus the Olmstead Act, VLC. It's truly been a blessing. I am very fortunate. I've been truly just being able to share my story, share what I've done throughout my life. Um, I really want to make a difference for all people with disabilities. But overall, we need to help each other out and begin to include our elderly, but ultimately, I want to work on making sure that our veterans are being taken care of. Those that have served for our country. I've had a couple of family members, but they serve not only just the United States, they're all around the world. They're working every day, every minute, every hour of every day. And those people deserve the utmost respect. They deserve to live within their own home, to live within their own community of their choice from, and we all do, from the day that we're born to the day that we shall pass. But lastly, I just want to say thank you. You all are amazing. We can work on many other important issues. And I just, it, in DC, in my speech, you could go to about the 50-minute mark, but please try to listen to the woman that speaks right before me. She is not the head of Office of Civil Rights, but she's the one step down. And she and the other lady next to me, her name's Holly Robbins, who is in the pink right here on the video. Holly's on the opposite side. They've been working with me for over a year, or about a year right now. They're amazing women. The woman standing at the podium up here, she is basically the head. She was also the one that really, truly helped. Uh, so the entire video is about 2 hours. You don't have to watch it all. I would like you to, but just you can watch it whenever you need or whenever you have time. Um, Brooke or Carla, if there's anything else you want me to say, otherwise I can end now. And I just appreciate all of you.
Garrett, I could listen to you forever. So thank you for all of those comments. And I really appreciate you providing advice on, what you did and what others could do. I do want to just and help me here, Garrett, too, if any of this is inaccurate or your interpretation is different. But I'm just reading from the release that was provided about your case, and our slide is kind of gives the big picture um,
Right,
of the settlement. But what the state now has to do for corrective action for Garrett is raise his provider's reimbursement rate. So, it
right,
wasn't just right. It wasn't just about that you weren't entitled to services, is that you couldn't get the services because reimbursement rate was too low. There was no, you weren't getting respite,
right,
your providers weren't getting respite. Um, and then being able to expand your base of providers so that you hopefully have providers who can care for you and providers who can care for you overnight, nursing providers specifically, so you have that care that you need at home. So it wasn't, I want to be clear, it wasn't that
right.
you weren't entitled to the services. It's just that the way things are set up in Iowa, you couldn't get them. And so your complaint was
Correct,
about
correct.
the way, right, the way the state functions. So I guess, what our challenge is, how do we look at this and then make a case that, it's not just like Garrett said, it's not just about you. You led the way, and hopefully you're going to get the services that you need now. But there are other people in this state who need the exact same services, and others who need similar services. And it shouldn't take a complaint going all the way to the
No,
OCR
okay,
um,
correct.
to make change. So I think it's on all of our shoulders now to figure out how we approach this and what we can be doing better in Iowa to advocate for Garrett and people like you. Um, so thank you so much for sharing your story, Garrett, and for being brave and doing what you did, you and your mom and your family, and what you've been doing for a lifetime. We
Um,
really appreciate you.
Thank you so much. So I'll just keep this kind of short. Um, and so Carolyn mentioned a few things. So in order with what I receive, I have Medicare, Medicaid, and through the state of Iowa, I receive the Iowa waiver program. I'm on the health and disability waiver. And uh, we were receiving $14.84. And I think that was right when uh, they increased the hours. Um, and so before that, it was even a little bit lower than that. Uh, so what we actually had to do is called an exception to policy or an ETP. But in order to do that, we need to talk to our case managers and ask for what we need. Um, Not everyone will need 24/7 care. Some people, yeah, they do need it. Some people might need for 8 hours, 12 hours per day. Each and every one of us is different. each and every one of us has a choice. Uh, Now, for us, we asked the state, and I'll be honest with all of you, for $22 an hour. Now, with the Iowa Board of Nursing, um, I require an LPN, a licensed practical nurse, or an RN, a registered nurse to take care of me. Well, right now, I I am receiving uh 12 hours at night. I'll tell you, it's not perfect yet, but we're getting there. We found one agency that will do um, CDAC, or Consumer Directed Attendant Care, and they bring in caregivers. We're still working out a schedule, still training people, but I want to keep people. I want to retain those people, keep them. Um, I'll tell you, I had one nurse that worked for me 26 plus years. I had others work for me 15, 10 years. I want to keep my people so they're good. Um, Kind of like family, but keep it professional also. Um, so I asked for an exception of the policy. HHS and the state kept denying every single time we would ask. And that started back in 2015, 2016, when the managed care organizations. I asked for 3 different case managers, and then I received a good one. Uh, that was very beneficial. Helped out a little bit with getting some other essential things for myself. I'll tell you one, uh, my ventilator needs power. My chair needs power. Other equipment in my bedroom needs power. Our first exception to the policy was a whole home generator because in Iowa here we had a derecho, and so that was our very first exception to the policy, and we were fortunate to receive that um, in 2022. But it took time.
Mhm.
Everything takes a little bit of time. Uh, and it's okay. But you really gotta kind of work through the process. You could ask, say you need a ceiling lift. That's another exception to policy. But talk to your case man. It shouldn't have to be an exception to policy. In my eyes, it's what you need. Uh, no, I am not going to ask HHS or my insurance company to provide me uh, like Alexa devices or um, whole home, where it's set up where I can talk to my mom through like an intercom system. That's it's our home. We could do those things, but to me, it doesn't need, don't, don't try to ask for 24/7 when you don't need it, or if you really want to keep a provider and you need that caregiver, yeah, you can ask for a higher wage, but try not to overdo it. Do it within a reasonable manner. Um, what I'm trying to do is two things: save the taxpayers a little bit of more money and show the state, show HHS that it's simply more beneficial. It's more cost effective to live within our own homes or the integrated setting of we're choosing. And when we're most happy and we're most healthy and where we ultimately love where we live. Um, Carolyn, you have any other questions?
Garrett, that was so great. Thank you for sharing all that detail. I mean, I know it's helpful for us to know your story and to know those details because we can then share it with policymakers, the people we work with, legislators. I hope there might have been a legislator on who heard you say you really want to save taxpayer dollars because we know that that's a priority for the state.
Yeah,
So we really appreciate that and where you're coming from. And I know just by looking at the chat that you've already have inspired some other advocates. So yes, we really appreciate your time and what you shared with us today. And I think we want to hear more from you. And
yeah, I want to continue on, and I have more plans, more ideas. As I said before, I'll post a couple more things in the chat. And otherwise, I want to thank you all. I appreciate you. I'll go back through the chat. I'll try to respond to you till we wrap up and we're done. But thank you all so much.
Thank you, Garrett.
yes, thank you, Garrett. I think now we're going to turn it over to Amy to talk about some federal policy going.
Well, hopefully we'll tag team it, Carlin, because as Carlin and I were preparing for this, and we'll move to the next slide, um, we had so many different bills we wanted to show you that have been introduced in Congress. So House bills, in Iowa, we have House files and Senate files. In Congress, they have HR and S. So an S bill will be Senate and an HR will be House. And so we kind of wanted to give you kind of a look at what's going on in Congress. While there's not a lot of action actually happening right now, there's there's been a ton of bills filed, and we have like Carlin's list was 4 pages long, and mine was 3 pages long, and there's some overlap, but we plan on talking about a lot of these in our quarterly newsletter that's going out next in a few weeks. But we wanted to give you kind of a snapshot, since the state legislature is out. There's a lot of things that you can do, as Garrett showed us, as Brady shows us, so when he goes out to DC, to advocate for some of the same things we advocate for at the state level. And so one of those you might notice right away is the Work Without Worry Act. And I have linked the bills, and so you can look at sponsors and where it's at, read the bill, read the summary. And this will be on our website. So you'll be able to get the actual slide deck, so you can click on these links. I know it's, I could put these all in the chat, but that would be a lot of links. So, but you'll remember that Representative Turek and others had introduced the Work Without Worry Act on the state level. And there's also one on the federal level that was filed. And that's S2196. And since I don't have these in any specific order, so I just want to mention that, but that bill is in, just trying to see down my notes here. I think that's in the finance committee. Somehow I didn't have my notes organized, but we'll have that in our newsletter. But that's one of those opportunities where you can earn more and not have to be living in forced poverty to continue to receive your supports that help you work. And then also you'll probably notice that there's a, if you go down, HR 6640 is the Marriage Equality for Disabled Adults Act. That is similar in some of the discussions we've had at the state level, which basically eliminates the marriage penalty for individuals who are receiving Medicaid or Medicare. And in the federal portion, Medicare would apply, and Social Security. So basically that would disregard the spousal income or raise that rate. So it's getting rid of the penalty when you get married. There's the SSI Savings Penalty Elimination Act, which is similar to that. The Direct Care Opportunity Act, and CARE actually stands for something. I can't remember what the exact acronym is, but it's a caregiver. It's grants to help states recruit and retain caregivers. It stands for Creation, Advancement, and Retention of Employment Opportunity Act. So you're seeing a lot of the same things that we're looking at the state level. Transformation to Competitive Integrated Employment Act, something that has been, I know Ben's on the call, has been really involved in. And the Protection and Advocacy for Student Success, or PASS Act, which addresses children with disabilities in the education setting. The HCBS Access Act has a ton of elements to it that improve and update HCBS services, including rates and reimbursements and updating the access language. You probably heard a lot about the John R. Lewis Voting Rights Advancement Act, as that addresses all kinds of barriers to voting, including for individuals with disabilities, and making it more accessible, but also for all voters in general. So as you can see, there's just a lot going on. And again, that's just probably a quarter of the list that we had in our own. There are bills on accessible transportation with, those that are flying with wheelchairs. There are issues within the corrections system, Mental Health Justice Act. There's also the Autism CARES Act, which we have noted here, that establishes research and training and monitoring programs around autism. So we kind of wanted to highlight some of these things so that you could maybe shift and think about what things you might want to talk about with your congressional representatives. So you all are represented by two U.S. senators, Grassley and Ernst, and one of Iowa's four federal House members. So that would be, Marionette Miller Meeks, Randy Feenstra, Zach Nunn, Ashley Hinson are our four. And they are all up for election this year. They all have challengers. So these are things that you can bring up when you see them in the community, if they have events or debates or opportunities to meet with them as well. Carlin, did you want to say anything more? I put a link in here to the National Disability Resource Network that has an excellent tracking bill tracker there with these and other bills.
Yeah, I'll just point out to or elaborate a little bit on something you said, that some of these bills or there's similar legislation that's been proposed in Iowa that covers some of these issues, such as SSI limits and income penalties, the marriage penalty. And the interesting thing about Congress is that they'll have an act that does something very specific, and then they'll put something like it in another bill. So that makes it both good and complicated to be able to track some of the issue, more on an issue level. I did want to point out that the Work Without Worry Act is different than what was proposed in the state of Iowa. So it doesn't, you can't, they're not apples and apples. You can't assume that with one passing that the other one wouldn't be needed for sure. In fact, Work Without Worry at the federal level is more like what Brady was talking about at the beginning, or he described to us earlier today, that his dad is retiring, and so that affects Brady's Social Security income, and that's something that this act is actually covering. And so Brady, we may want to talk about this and contact Senator Grassley about it, because he is on the Senate Finance Committee under which this bill is under. So one that I want to highlight, though, is the fourth one on the list here, the HCBS Access Act. This is one that many disability policy groups are focusing in on because it has some potential. And it covers a couple of things. Obviously, access to Medicaid programs and waivers that may eliminate the need for complaints like Garrett's that have to go to the Department of Justice to be resolved. It also includes something that we've talked about in the past, which is for direct support professionals, for that profession to actually have a separate classification, a job code classification. So that's an important one, and it's one that I think we're in our organization at the national level is monitoring very closely. So as Amy said, we have a lot of things that we could talk about that are going on in Congress. One of the bad things is like not a lot of it is moving forward. In fact, not at a quick pace, which give Garrett the award for patience in all that he's had to do with complaints and trying to make a difference, and how long it takes. And the same is true, as we know, with legislation. These things take time, and it takes education. So, and it takes all of us educating our members of Congress too, as Garrett has done, on how these changes can make a difference. So we wanted to point that out, that there's a lot going on, and even though things aren't moving, because there's a lot of gosh, I don't know what you call it, division in Congress, that we don't have much say in, except we can vote if we want that to change. But at the same time, these are things that we can contact our members of Congress about, and tell our story from Iowa. And we're going to come back to Brady here in a minute and have him talk about his recent trip to DC and how he thinks advocates can make a difference. But we want to talk about rules real quick here, Amy, right? And then we'll move on to
Right.
Brady.
Yeah, I think what I will just say is read the new newsletter when it comes out, because in the next slide here that Emily's going to pull up, we just listed some of the rules changes. I just wanted to, these are a very small number of the rules changes, and I have a link in there so you can see a fuller list, a longer list of them. And I just wanted to make a point. I think Carlin and I wanted to make sure that you all knew that there are many ways to make changes. And one of those is through Congress, through legislation, but the other way is through the administration, currently the Biden administration, but before that, the Trump or the Clinton or the Obama administration issue. Sometimes they issue a resolution. Sometimes their department heads go ahead and change rules without needing to pass legislation. Usually those go through fine. Sometimes you get a challenge in court that says they go beyond their authority. But like one of them that you'll notice is ensuring safe accommodations for air travelers with disabilities using wheelchairs. That's also one of the bills that we had on our list. But the administration has gone forward. They extended the comment period again. It just ended on June 12th. And so they'll start moving through those and finalizing them. So there's multiple ways that things change at the federal level. It does get confusing, but we will talk about these and others in our newsletter. Just in the interest of time, I want to make sure Brady has enough time to speak. And I was going to mention before with the bills that we had listed, I did look through all of the sponsors and co-sponsors, and none of Iowa's delegation were sponsor or co-sponsor on any of those bills. So those are also opportunities that you can ask your legislators to sign on to a bill as a co-sponsor. Unlike Iowa, where before you file it, you have to have your sponsor set. In Congress, they can continue to add on names as it goes through the process. So that's one other ask you could have is maybe you should consider sponsoring this bill or co-sponsoring this bill. But let's move on to Brady.
Yeah, and I just wanted to set Brady up here for a second because Brady and I attended the disability policy seminar in April in Washington, D.C., and this is where we gained a lot of our new knowledge about what's going on in Congress, obviously, and we talked to our congressional representatives, but what the administration is doing in this work and how much that they have an emphasis on home and community-based services. And that was an impressive uh, array of items that they're working on. And so I asked Brady if he would share today what he came away with from from our trip to DC and his advice for you all as advocates. Go ahead, Brady. Thank you for doing this.
Yeah. So as Carlin said, we went to the disability policy seminar, um, and Carlin, there's two bullet points that I really think would be important for me to talk about in this meeting today. Um, and one of them is the one you just mentioned, the home and community-based services. You know, um, the issues around home and community-based services is not just happening here in Iowa, it's happening everywhere. And what I mean by that is you know, individuals with disabilities are trying to get home and community-based services, and it's just either taking forever, which that comes into the waiting list thing. It's taking people forever to get um, qualified for services. And so when I was in Washington, D.C., I addressed those concerns and tried to step up as a self advocate and say, we need to start looking at how we're serving our Americans, especially our Iowans. There are too many people that are being put on a waiting list and waiting way too long to get the help that they need to live a successful everyday life. And, that is not the way our state, that is not the way our country should be looking at it. What we need to do is we need to continue advocating and continue assisting these people with intellectual disabilities to live a fair and healthy life in the community wherever they want to live. Um, so that's one of the bullet points that I um, got out of going to Washington um, and to learning about the issues around home and community-based services. Um, the other one, um, which I just thought about this morning, Carlin, but I do think it's important because it was one of the reasons why we went with the REACH program is employment. It I don't know if it's just in Iowa, but I mean it's probably other places too, but um, it's hard sometimes for people with disabilities to find a job that best suits what they need for them and their disability. Um, I kind of want to go back real quick. When I lived at the Glenwood Resource Center, we were told back in what was it, 2021, 2022, that the Glenwood Resource Center was going to be closing. And at that time, I was living in home and community-based services and was told that in 2024 the facility was going to be closed down. Well, I was going to lose my job. And so were a whole bunch of other individuals with disabilities were going to lose their jobs on campus. So what do? I have two housemates that lived with me at Glenwood that have moved from the facility into home and community-based services, and they were kicked out of their jobs at Glenwood because Glenwood was closing. But about a year and a half, 2 years later, they're still unemployed without a job because the community is not the type of community with the population to assist people with intellectual disabilities to find a job that best suits them. And so I feel like the Work Without Worry bill can help individuals with disabilities to find the job that best suits them. It might not be $16 an hour, but it's something that can help them get moving forward in the right direction. And so I still strongly feel like employment is a topic that we all need to continue advocating for. Home and community-based services is a strong thing that we need to continue to advocate for. Because, like I've said, and several people have heard me say before, if we quit our advocacy, the work's not going to be done. We got to keep fighting. We got to keep pushing forward and letting people know what our concerns are and what direction we need to continue to go.
Thanks, Brady.
Thank you.
We're short on time. I'm gonna let Amy do the wrap up.
Well, I think that our wrap up is thank you guys all for joining us here in June. And I just wanted to remind everybody we skipped July because it seems like everybody goes on vacation in July. And we will be back on August 23rd, which is not the normal cycle, but we had to avoid the Friday before Labor Day. So we're going a week early and we are switching to noon for our capital chat. So that we had kind of announced that last time that that this would be the last one at 11 and we're switching to noon as we've heard some people would like to join over their lunch. So hopefully that works with people. Let us know if that creates new problems for you. We're trying to find a way to get as many people possible engaged and have an opportunity to talk about these and other issues. And as I put in the chat, Carlin and I and Brooke always love to hear what people are working on, whether through another of your associations or personally. And if you would like to talk about your issues and inform others about what you're working on, this is a great opportunity. Let us know, and we'll give you some time on these calls to kind of talk about what you're working on. Who knows, you might gather some more advocates.
Amy, could I just bring something up?
Yeah, sure.
Yeah, I'm Fran with Iowa Caregivers. I just was in communication with Di, the director, a couple of days ago, and we had received the Harkin Institute newsletter, and they asked in that newsletter, they brought up about ABLE accounts, the tax-free savings and investment accounts for those with disabilities to help save for things like, food, housing, education, whatnot. But they mentioned currently only a fraction of eligible Iowans actually have an ABLE account. We were just wondering, thinking that, gee, we really need to learn more about this. We don't know much about it. So we wanted to ask if you will be presenting on the ABLE program that they mentioned in that newsletter, and whether we should be promoting that, advocating for that, and if so, how best would we do that?
Fran, if I could go ahead and answer that for you. The council does do 2 webinars on the iAble account every year. Our last one was April 1st, and you can still find that recording on our website. And the Harkin Institute is also doing an iAble, I don't know if you call it a summit, on July 13th. And we are actually sponsoring that. The DD Council is, for the first 10 people that sign up to meet with their financial advisor. We're sponsoring $100 investment for 10 people to open an iAble account. And that's in their latest email that just went out today. So we present on the iAble account frequently throughout the year. But do take advantage of that July 13th date for people that do not have an account.
Thank you.
Thanks, everybody. We'll see you in August, hopefully.
Thanks, everybody.
All right. Thanks, guys.